Hi, my name is Anna Grabowska, and it's a pleasure to meet you for this topic in class. I am a registered nurse and I work in ventilator dependent unit. For this assessment, I will identify how poor collaboration can result in inefficient management of human and financial resources, supported by evidence from literature, reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes, identified best practice interdisciplinary collaboration strategies to help a team to achieve its work more effectively together, identify best practice leadership strategies from literature which would improve an interdisciplinary team's ability to achieve its goals. My work is very sensitive and depends on collaboration, good leadership, and communication because my patients are on ventilators and tracheostomy collars and have a very special needs. To be successful, the nurses and staff need to work together on communication as one unit. What I saw from my first experience in joining the unit is that things that are not visible could affect the way we work, the care of our patients, and how our unit is managed. The incident that I would like to talk about is what I called quiet bullying. When I joined the unit, I was just out of school and inexperienced. Meeting our patients and doing the simple task with the unit staff was exciting, but I started to notice a pattern. When a patient needs a critical procedure such as the installation of a ventilator or assistance with the tracheostomy collar, the same group of nurses did the work every time. New and developing unit nurses like me were always put to the side. We did not get a chance to do this work. After work on the patient was done, none of the experienced nurses came over to talk about what they did and teach us. After talking with the new nurses like me, we agreed that we were being bullied by not being included in sensitive work that would allow us to learn, gain more experience, and develop. By looking at the body language of the experienced nurses, it looked like they had run the unit and did not want any competition. Management would not say anything because this group would get the work done. I started to feel offended by this bullying because it's my job to help our patients and develop my career as a nurse to contribute to care and lives of our patients. I feel that this was bullying because according to the article in Journal of Professional Nursing called Nurse Faculty Bullying Concept Analysis, us being excluded from fully doing our job and learning was negative interaction between nursing faculty and repetitive behavior that create an imbalance of power and responsibility in our unit. I feel that my concern was justified because, according to the article in Perspectives in Psychiatric Care called Relationship between Communication Skills and Care Behavior of Nurses, communication is not only an ability differing from person to person, but also it's a skill that obtain with necessary training can be obtained with necessary training and experience. I clearly was not getting that training and experience because of this bullying. Also, there was a little collaboration in our unit because of this. So, for me, this is a good example of poor collaboration where nurses like me were not being used to help patients, not allowed to develop and get experience, and costing our hospital money by having us stand around and do small tasks. When I talked to my manager about this, she began to see my point. After bringing the new nurses like me into the conversation, the nurse manager said that the unit has been focused too much on performance lately and that our unit was becoming unhealthy, causing this kind of bullying to happen. She admitted that she did not see this happening and apologized. All of us came up with the idea of getting some of the ICU nurses to work with us on task and teamwork. My manager said that this interdisciplinary collaboration would allow us to break up this bullying, see how different units work together, and create a learning and teamwork environment. A week went by, and the ICU nurses came in to work with us. I began to see changes right away, and the experienced nurses that bullied us began working with us on critical tasks. Over the month that the ICU nurses work with us, I feel that this interdisciplinary collaboration was successful because that concern that I had almost completely went away, which was the desired outcome. From what I experienced, I feel that one of the best practice interdisciplinary collaboration strategies that really worked to bring us together was getting our priorities back in order. According to the article in Plus One called Challenges and Strategies in Patients' Health Priorities Align Decision Making with Multiple Chronic Condition, communication strategies facilitate patient performance based and priorities based decision making, especially for the kind of patients and responsibilities we have. We are shown by the ICU nurses and training activities that our collaboration need to be respectful of and responsive to individual patient preferences, needs, and values while ensuring that patient values guide all clinical decisions. We are shown that this is our job and main priority. When the ICU nurses work with us, they showed other team members how to do new things and made sure that their focus was the patient, not just who could do a task better. Also, I feel that one of the best practice leadership strategies that work to improve our unit's ability to work with each other and other units was the use of films. According to the article in Nursing Education Perspective called Shifting Strategies Using Film to Improve Therapeutic Communication in Nursing Education, film creates a safe space for staff and management to share their diverse emotional and cognitive responses. The films that were shown to us did just that and were focused on multidisciplinary teamwork. The film the films allowed us to bring in our thoughts, concept, and experience into our conversation and forced us to work together in coming up with teamwork solutions and strategies before going back on the floor to help our patients. On the floor, the ICU nurses made sure that we were working together and doing what we all agreed on our patients together. I saw that this was working, and the experienced nurses began to see the talent we have and how much we could contribute. In the end, I feel that this initiative was a success. I feel that our unit became much better at working with each other thanks to this interdisciplinary collaboration and best practice leadership strategy example. I feel that our unit was more prepared to meet our unit goals and more ready to successfully work with other units of our hospital. After this, I feel that our patients were in the better hands of care and my work environment turned into a patient first learning atmosphere. Thank you for listening to me, and I hope that this experience also helped you. Thank you.